Vasopressor drugs are a class of medications that increase blood pressure and work by inducing vasoconstriction. We created this video to cover the medical definition and provide a brief overview of this topic. So, if you're ready, let's get into it. When it comes to pharmacology and respiratory care, most people only think about the medications that are given to affect the lungs. The heart and cardiovascular system is often overlooked. However, it's important to remember that respiratory therapists are trained to provide care for patients with conditions of both the heart and lungs. That is because these two major organs work together to pump oxygenated blood to all of the cells and tissues within the body. Therefore, if a disease is inhibiting the functionality of the heart, it could inadvertently affect the lungs as well. All of that to emphasize the fact that cardiovascular drugs are an important class of medication to learn and understand. There are a few primary types, however for this video we're specifically focusing on vasopressor drugs. As previously mentioned, vasopressors are drugs that work by inducing vasoconstriction, which can increase the patient's blood pressure, which means that this type of medication is indicated for the treatment of patients with moderate to severe hypotension, which is often the case in those who are critically ill. Some examples of the most common types of vasopressors include epinephrine, norepinephrine, dopamine, and dobutamine. Epinephrine is the vasopressor of choice during CPR. It's an endogenous catecholamine drug that acts on beta-1, beta-2, and alpha receptors, which results in an increased heart rate, stroke volume, and cardiac output. Its effect on alpha receptors is what stimulates vasoconstriction. Norepinephrine is structurally similar to epinephrine, however it acts mostly on alpha receptors, which works to increase and maintain blood pressure. In comparison, epinephrine acts equally on both alpha and beta receptors, which means that it has more wide-ranging effects. With that said, both can still be classified as vasopressor drugs. Dopamine is a neurotransmitter that, when administered in high doses, stimulates alpha receptors, which results in vasoconstriction. It is often given for the management of shock and in patients with bradycardia that were unresponsive to atropine. Dobutamine is also a catecholamine drug that stimulates beta receptors and works to increase stroke volume and cardiac output. Because of this mechanism of action, it can indirectly promote vasoconstriction. With that said, dobutamine causes systemic vasodilation, so its overall effect on blood pressure is often unpredictable. However, in hypotensive patients, dobutamine is effective in maintaining their mean arterial pressure. Some other types of cardiovascular drugs to be familiar with include inotropic agents, antiarrhythmic agents, vasodilators, and anti-anginal drugs, each of which are medications that we've discussed in other videos here on our channel. But again, for this video, we just wanted to provide you with a brief overview of this topic. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well, because we have a ton of other videos on our channel that I think you will enjoy. Just a quick reminder, we are not doctors. This video is for educational and informational purposes only. And if you want to dive deeper and learn more about this topic, you can go to respiratorytherapyzone.com, where we have a ton of free study guides, practice questions, and other helpful resources. I'll drop links to everything you need right below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.